I've struggled with this my whole life. Just made me so insecure. It's life-changing.
Alrighty, Dr. Lebo, Gyno and Beyond. Second case of the day on this Saturday morning in January. This 25-year-old young man from Maryland who drives up for my gynecomastia expertise. Maryland is not that far. It's I think it's like 4-hour drive. It took him, so he'll stay tonight and see him in the morning and go home. I'm covering the nipples up because Instagram and social media doesn't like nipples. They can't differentiate between female or male nipples, so I just cover him with these little things going on there. But he's in shape. He's got great muscle. I don't want to, my audience will say you're dishing on your patient. Sure, he can lose about 10 pounds. His chest is good. His shoulders are good. Really amazing. Maybe his midsection there can use a little bit more, working out, either crunches, probably diet more than anything. Those late night snacks, those pizza and the beer and alcohol. Just kind of get that out and lose about 10 pounds, and he'll have some abdomen work. But this is really great. He's fine on there. Speaking about the chest, he's got these glands, which just a little puffiness, and it's cold. It's cold in New York. It snowed last night, and he just finished driving up. But if you grab these, you can feel the meats right underneath here. And no lipo. He doesn't need any lipo. Sure, he's got a little bit of fat here between his lats and his pecs, but again, diet down 10 pounds, get his summer body back, and he'll be fine. Again, on this side is the same thing. This side I think is a little bit bigger. I can feel it better. Get really under it. When I tell people to feel it, really kind of excavate it out with your thumb and index finger. Get in there, grab under it in like one of those, prize things where you go down, you try to grab the prize like in Atlantic City and then bring it out type of a thing. That's what I want people to do. Not pinch it, but to grab it. But it's cold now. He complains about puffy nipples seeing through his shirt, and that's what we're here for. No lipo. Perfect, comfortable, and safe under local anesthesia. Tiny incision where the water meets the beach. Get those glands out. No drains. And he'll look amazing because my work is guaranteed. So if you have gynecomastia, you call me Dr. Lebo Gyno and Beyond, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go. All right, so gyno is kind of like this, right like that. That's the pec muscle right there, and that's where we're gonna be going, numbing the area, right like that. Boom, boom, boom. Nice. Perfect. And then where the water meets the beach, just like that, perfectly. With this color skin, you got to be careful. Darker skin kind of scars worse, so I want to make that tiny and put it together perfectly. All right.
Hello, let us begin by introducing ourselves. I am Hans.
I'm Franz.
And we want to pump you up.
Haven't figured out how to remove the glands through your belly button yet. That's coming though. I'll figure it out.
You feel lipo in neck?
I do. I've got to set. I don't like doing it. There we are. I see the glands.
When you were doing your residency, have you seen one of those surgeries like where they go through like the iliac vein to put
Oh yeah. Oh yeah. Oh yeah.
Is it complicated?
No.
Or it's just
No. Usually the femoral. Usually the femoral, if I remember.
it's just like a huge catheter. I
Yeah.
imagine, right?
Yeah. They just fluoroscope it, get it in there. Good, it's there. Shoot some dye, make sure you're in the right place. Okay, let's see where we're at here.
When did you say the Coumadin guy is coming?
He's on Coumadin, but he's gonna be off. We're gonna put him on, what's the short acting one? The sub-Q.
Lovenox?
Lovenox. And he's gonna stop the Lovenox a couple days before.
Put the towel here.
Yeah.
When is his surgery date? Next
February?
Oh, okay.
February. Nicest guy. He's a oral surgeon in North Dakota.
Oh, okay, good. So you should know what to do. You should be compliant.
Well, I'm gonna get clearance.
Good.
Oh, nice glands. Could be a nice glands in here. You know, I'll listen to what his cardiologist, because he's got like a valve. But in Europe, the valve doesn't need Coumadin. Here in the US, they do. I guess there's rules.
What's the reasoning behind that? Do you know?
I don't know. You know, in Europe, they're a lot less.
Which one is smoking?
Not yet.
No?
Let's see here. Yeah, give me it. Give a quick little tap. Good. There we go. All right, so guys, guy's got a little bit more body fat than the first guy we did. And the glands are, but I can see, and the beauty of it on the local is I'm seeing exactly where these glands are. With me, you're not going to get a concavity. Only get the glands out. Here we are. she left. There you go. Here's a glance. Look.
I don't even want to see it.
You don't want to see him? Oh, you wouldn't.
No, I'm one of those guys.
All right, this looks beautiful. That is gorgeous.
I'll see it when you're done.
All right. All right, now, let's look in here. Let's see. Let's look over here.
You want this one?
Yeah, sure. Thanks. Hold that up there. All right, so the glands are out.
Okay.
Oh, this Tati. And now this one will kind of blend the fat,
Okay.
you know, so you don't have like a little hole. So just go in there and blend some of the fat. Go there, go this side. My patient's soupy today. Why are they soupy? Grab some of this junk on the side here. Nice. Now. There you go. Lift up this arm just a little bit over here. The right arm you can put down if it gets numb.
I'm
Yeah,
good.
you good? All right. Sometimes lifting it up so much it gets numb a little bit. So again, I search for the white. That's what I look for. fluid that I put in. Nice. Let me put this underneath here a little bit. Soak up some of the juices.
Does that like dissolve over time?
What's that?
The fluid?
Oh God, yeah. It's like an IV,
Gotcha.
but instead of in your veins, it's on the skin. Like when they do an IV for dogs, they don't start. They just put, you know, depending upon the size of the dog, you know, X amount of cc's under the skin and absorbs it. If they come in like dehydrated into the vet, same thing. There you go. Good. I know. Alrighty, Dr. Lebo, Gyno and Beyond. Second case of the day, bilateral gynecomastia gland removal on this 25-year-old young man who drove in from Maryland. The girls took the gland away and put him in the specimen bottle because they're going to pick up today, and they wanted to get it on and picked up for pathology. So I don't have those to show you, but they're about even. I think the left side was a tad bigger than the right. Under local anesthesia, we did direct removal of the bilateral gynecomastia gland tissues. We didn't do any liposuction. I don't like doing liposuction on fit guys because it ruins the natural athletic nature of his chest. Can you imagine me liposuction and flattening this down? Remember, with me, it's not about making you flat, but it's making you athletic without puffy nipples. And that's what I accomplished. I got rid of the glands totally, 98% totally, maybe a little film just underneath the nipples to prevent them from collapsing. I did my internal quilting stitches to tighten the pectoralis major muscle and lift the nipple on top of the muscle itself, so there's no concavity, there's no droopiness. He'll look athletic. And those are all self-absorbing stitches, as are the internal stitches where I made the stealth incision, where the water meets the beach, from the 3 o'clock to the 8 o'clock position below each nipple. They're covered now by an antibiotic gauze. But as you can see, now make a muscle, how athletic he looks, how full and athletic he looks. The midline, male cleavage, and the abdomen we didn't touch, but he looks great. I wish for him to lose 10 pounds, tighten up, get his body fat down, a couple percentage, and he'll look absolutely perfect for the summer months. So if you have gynecomastia, you call me Dr. Lebo, Lebo Gyno and Beyond, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go.